Let me say good afternoon, and today I'm here with Chief Acevedo, Chief Pena, Dr. Persse, and so let me just say good afternoon to everyone on this Monday. I want to begin today by acknowledging the death of one of our Houston firefighters, Jerry Pacheco, who was assigned to Station 101 in Kingwood. Uh, Firefighter Pacheco died this morning from COVID-19 of complications. On behalf of the city of Houston, I want to extend my prayers and condolences to his family and fire department colleagues. Pacheco is the second Houston firefighter to die of the coronavirus. The funeral for Captain Leroy Lucio was held last week, and I'm sure that Chief Pena will have more to say. We have also lost 6 of Houston municipal employees in the last several weeks because of COVID-19. And I was also informed this morning, Chief Acevedo, that the wife of a Houston police officer has died from the virus, and I believe she also lived in the Kingwood area. The tragic deaths are a reminder that community spread is still a concern in the city of Houston. July for Houston, July was a tough month for us. Our positive cases and the number of deaths doubled compared to the 4 previous months, March through June. So we lost more people tested positive in July than the 4 previous months. Today, the Houston Health Department is reporting 1,104 new cases of COVID-19. That's 1,104, bringing Houston's total now to 50,896. Sadly, there are 6 newly reported deaths, bringing the city's total to 478. The demographics of the 6 people who died are on the monitor next to the stage, and you will note that the youngest person was a Hispanic man between the ages of 30 to 39 years of age with no underlying health conditions. All 6 who passed away that are being reported today are Hispanic, and I want to express my condolences to each and every one of their families, their relatives, their friends, those who they work with. It is imperative that we bring the number of people who are testing positive and dying down as much as possible in the month of August. I want to applaud the Houston Health Department for launching its Better Together, Todos Juntos Mujer campaign to target communities with high positivity cases. They are literally going door to door in many neighborhoods to educate people with their community outreach campaign. While they're out there, they are wearing masks. They're also practicing social distancing when they go out in the community. Over the last several months, our focus has been on educating and encouraging people to mask up, social distance, and wash their hands. So in March, April, May, and June, the message has been put your mask on, mask up, engage in social distancing, and exercise proper hygiene. So the focus has been on education. And yes, there are some positive signs from those efforts. Hospitalizations in the city of Houston have declined. That's a good thing. But they still remain high. The positivity rate has dropped. Last year, we were talking about the positivity rate being around 23%. The positivity rate as of today is 17%, so it too is dropping. But we need that positivity rate to be 5% or below. That's the goal. 17 is too high, 10 is too high. The number needs to be 5% or below. And because we cannot repeat in August the numbers that we had in July, today I'm announcing that we will begin issuing citations to people who are not wearing their masks under the state's mandatory mask order. When we started this process, it was about educating. We have been doing a lot of that. But now, when our police officers and firefighters and others are encountering people who are not wearing their masks, we are going to be issuing the necessary warning. Please put on your mask, and a failure to do so will cause a citation or ticket to be given. We are not going to be responding to 911 calls when people are calling and saying so-and-so didn't respond to, don't have their mask on. HPD will not be doing that. But when we are encountering people on patrols, out and about, and we are seeing that they do not have their masks on when they're in public and around other people, we will provide the necessary warning, and then a failure to heed to that warning will lead to a citation and a $250 fine. So please, I'm asking you, people in our city, when you're in public, you're around other persons, please put on your mask or you run the risk of receiving a citation. We know that wearing a mask or a face covering in public is one of the most effective methods to slow the spread of COVID-19. For months, we have been focusing on education and not citations, but now I'm instructing the Houston Police Department to issue the necessary warnings and citations to anyone not wearing a mask in public if they do not meet the criteria for an exemptions. So please, don't get mad at the police officers. It's all about public health and driving our number down, especially when school people in-person schooling is scheduled to start in September. Fall is right around the corner with flu season. August then becomes a very, very critical month. Lives are at stake, and so I'm taking this step to do our very best to drive these numbers down. And I'm asking for your cooperation in helping us to do that. And again, as we have seen the hospital admissions go down, that's a good sign. We are seeing the positivity rate starting to drop, that's a good sign. But being at 17% is a long way from being at 5% or below. And if you notice, I think this is the 5th day in which I'm reporting positivity cases of at least 1,000. That is still way too high when you consider, for example, in April and in May, we were talking about 125, 150, certainly no more than 200 cases. So we need to drive those numbers down, and I'm asking people to cooperate and work with us in order to get that done. Now let me pause and call up first. Let me call up Dr. Persse.
Thank you, Mayor. Last month, the mayor proclaimed August was going to be Better Together month here in Houston. And in doing so, he has brought us all together to do better and challenged us to do better. He emphasized, and he just did again, a need for us to get the positivity rate down to below 5%. Last week, when I reported the positivity rate had gone from its high of 25.9%, last week we were at 23.3%, which was not a very big drop. This week, it is down to 17.6%. So that's a considerable drop. So I think it proves that when we work together, we can do better. So Mayor's right, with our Better Together slogan, it can become reality. And we need to keep moving in that direction, because while we have moved, and this graph shows, the purple line is the 14-day average. So that is we calculate that to make sure that it doesn't have a lot of variability from day to day. That is a very solid number. And you can see that the purple line does dip down to the 17. You'll see that the bars are dropping down as well. And that's a little bit misleading, because that has to do with the volume of tests. So that has nothing to do with the positivity rate. That is the volume of tests. So what that indicates is something we also talked about last week, and that is there is lots of testing which is still available. People are not going and getting tested as much, which has me concerned. But to focus on the positive, I want people to know that if you want to get tested, you call our number at the health department, there is plenty of testing capacity and capability available. So if you were worried about there being long lines, that's not quite so much an issue anymore. We have plenty of ways to get you tested, and we will do that because, unfortunately, not everybody is taking advantage of it. So let's go ahead and take advantage of it. Now is the time. We're moving in the right direction. Let us not lose momentum. On our next slide, we're going to look a little bit more graphically. We looked at the neighborhoods. We've shown slides like this before. And again, I want to caution everyone that the darker the blue, those are the neighborhoods where we're seeing the higher percent positive. Remember, the dark blue here indicates a zip code where the testing positive rate is greater than 30%. So that is very, very high. But also note that those that are more lightly colored, they can still be up to as much as 20% positive. So that does not mean that there's no activity there. That's one thing about using the colors here that can be a little bit misleading. There is virus spreading in each and every zip code in Houston. And this reflects the residents of the people where they live. This doesn't reflect where they became infected. And we update this every week, and this helps us with the health department as we drive our efforts into neighborhoods to try and get folks the help that they need, whether it be awareness or an opportunity to be tested or whatever other resources. And as the mayor pointed out, we are now going and knocking door to door in neighborhoods to make sure people get the information they need. And the next thing I want to point out is when we get tests that come back that are positive, those are considered to be cases. And we will then start off with case investigation. So we reach out to the folks who have tested positive. And if you should get a phone call where the caller ID is Houston Health and or the number is 713-853-8700, that's the health department reaching out to talk to you to make sure that you have everything you need to know if you've tested positive. That also starts the process of contact tracing. So that's the phone number. You may get an email, because when you signed up, if you gave us your email address, you may get an email from Houston Health Department at qualtricssurvey.com. That's going to be our way of reaching out to you, because that's how you indicated you wanted to be reached out to. Or perhaps you'll get a text message from one of three numbers, 35134, 73940, or 39242. Again, this is our way of reaching out to you to get that case investigation started. Now, here's the thing that's really important. If we as a community are going to get ahead of this virus, and we are currently behind it with a positivity rate of 17.6%, we are still behind it. If we're going to get ahead of it, that means we need to contact the cases, talk to them, and then find out who their contacts are so we can tell them that they need to protect themselves and their loved ones as well. That's how we get ahead of it. So please, when we reach out to you, take our phone call, take the email survey, text back with us, work with us. We will never, ever, the health department will never, ever ask for anything like your social security number, your immigration status, your bank account number, none of that stuff. If anybody starts asking you those sorts of things, that's not us. Hang up, click off, do whatever. That is not us. We will never, ever ask for that. We have no reason to need that information. So we will never ask for that. We will ask you about where you've been, who you've been with, and help us help you. And remember again, the people that you're most likely to infect, number one person you're most likely to infect is a family member. The number two person you're most likely to infect is a coworker. And after that comes friends and neighbors. So we're looking out to protect the people that you care about the most. That's your family and your coworkers. So help us help you protect your neighborhood and your family and those that matter most to you. And then finally, one thing I want to say, and I know Chief Pena is going to probably talk about this too, but if you start developing symptoms, know, I'm switching hats from my health department hat to my EMS hat, know that if you're developing symptoms and you're feeling ill, that's the time to start reaching out. Whether you've got a primary care doctor, if you've got a home health, or a health home rather, a medical home, reach out. We want to help you. Please don't wait until you're so sick that you're in real big trouble. It makes it more difficult for folks to treat you and to get you back on your feet. So once you start getting sick, go to a clinic, call your doctor. If you need to call and go to a hospital emergency department, so be it. Remember, 911 is for emergencies only, but don't wait until you're so sick that you're in really big trouble. And I know that I believe Chief Pena is going to probably talk on that too, but those are my comments today, Mayor.
Chief Pena.
Thank you, Mayor. Good afternoon, everyone. So, as the mayor mentioned earlier, it's with heavy heart that I report that we have lost a second Houston firefighter due to complications of coronavirus in as many weeks. And I want to offer my deepest and most sincere condolences to the Pacheco family. I did speak with his son, who's also a Houston firefighter, Justin, this morning. Actually, I talked to him, we texted back and forth yesterday, and his dad, firefighter Jerry Pacheco, was still doing well yesterday afternoon, and this morning, sadly, we got the news that he had expired. He took a turn for the worse and he expired. So please keep the Pacheco family in your thoughts and your prayers. Justin, Jesse, and Janeth we're thinking of you and we're lifting you up in prayers, and please ask the community to do the same. In regards to quarantine for the Houston Fire Department, we're at 130 today. We have 31 firefighters that are positive for coronavirus at this moment. None are in the hospital. In the total operation, we've had 218 firefighters that have tested positive. 187 of those have since come back and returned to work. So, this thing is hitting the Houston Fire Department really hard. And I'm sure my colleague, my friend Art, will share the same about the Houston Police Department. We're asking the community to please help us do your part to ensure that we're stemming the increase of this virus. The best recommendations that we have right now, and we've been hammering them every time that we come up here, 3 simple things: wearing your masks, proper hygiene, and the proper physical distance are going to go a long way to ensure that we are stemming the increase of this virus, and it's going to help us create some capacity and try to get ahead of this sooner than later. We have, in regards to our occupancy task force, in the last 24 hours, we had 86 complaints that we responded to. We had 2 referrals, 2 businesses that were referred to TABC for lack of compliance and lack of movement towards compliance as well. So again, look, the Houston Fire Department is going out. We are a resource. Our inspectors and our investigators are a resource for these businesses to help them come into compliance. The vast majority, we've had over 9,000 complaints since we began these orders, and the vast majority of them have been resolved correctly and voluntarily, and we appreciate that. Those that don't, they are going to be referred to the TABC. The TABC has taken quicker administrative actions. And again, it's about creating a safe environment for your patrons and these businesses. The mayor and Dr. Persse mentioned the calling 911. If you've seen it in the news, we've reported the fact that we are seeing a heightened number of people that are expiring at home, okay? They call 911 for an emergency, and by the time that we get there, there is nothing that we can do. People are just waiting way too long to call 911. If you're having symptoms of the coronavirus, shortness of breath, chest pain, any other true emergency, call 911 immediately. We've heard anecdotal comments about people being afraid to be at the emergency room because they think that's where the virus is. That is not based in fact at all. And you're much safer at the emergency room than you are at your home if you're having a true emergency. If you're having slight symptoms, a fever, aches, call your primary care physician. Call them early. Again, it's important for you to be evaluated early so we can have so you can have a better chance of surviving this and making it out. When you call 911, again, to the entire community, the entire city of Houston, I want to mention the fact that any information that we obtain is strictly for patient care and to communicate that appropriately to the receiving hospital. We do not share this information with any other agency other than the insurance and the hospital where we deliver our patients. So do not be afraid about immigration status or any other item that may keep you from calling 911. Our focus is to ensure your safety, treat you appropriately, and deliver you to the hospital where you can get definitive care and do it early. That's my report. Thank you, Mayor.
Chief Acevedo, HPD.
Thank you, Mayor. First and foremost, I want to extend my condolences to the Pacheco family and to all of the men and women of the Houston Fire Department. We've been praying for the Pacheco family since we found out that he was sick, and now that he's passed. And also to, I'm not going to release the name because I don't have that ask from our officer, but his family, and to all of those impacted by COVID-19. I mean, this is our second firefighter. We've lost 2 members of our department that were support team members. We have extended family that we've now lost, and Mayor, so I join you in saying that it's time for people to do the right thing, just wear a mask. We've got a lot of things going on in our city and our country, and the last thing we need is to continue to get each other sick simply because we want to exercise our right in our minds. And what we need is for people to stop worrying about selfish interest and think about the collective interest. We are better together, and we don't want to write tickets. What we want people to do is do the right thing, to follow the science and simply have the courtesy to wear a mask in public and follow the other health and safety guidelines that have been put out. Just to put this in context, Mayor, we've had in our department now, as of today, we have 172 members of the Houston Police Department that are in quarantine. Out of that 172, 108 have already come back positive for COVID, and 64 are awaiting their results. And this happened very rapidly. We had been doing very well until right after Memorial Day when we started opening the state, and we only had I think mid-40s. Well, now we've had 439 members of our department, 439 members of our department that have come back positive. And it's impacting disproportionately the African-American community and the Latino community, and it's really important. I want to, for a minute here, just talk to the Latino community, the immigrant community, the Spanish-speaking community. Es muy importante que la comunidad hispana sepa que este virus, COVID-19, es un virus muy peligroso. Hemos perdido otro bombero, 2 bomberos ahorita, miembros de mi departamento, y es importante que la comunidad hispana sepa que el impacto ha sido muy grande a los latinos y a los hispanos en este país con este virus. Es importante que se pongan las máscaras, que presten atención, que mantengan la distancia social de 6 pies y más importante que nada, póngase la máscara, lávese las manos y vamos a proteger a nuestra familia, a nuestros colegas, a nuestros vecinos y a nuestros oficiales y bomberos que están en peligro todos los días. En el departamento de la policía hemos tenido más de 400 oficiales que han cogido el virus y muchos de ellos ha sido por los contactos públicos. Si se siente enfermo, es importante que vaya y llame a la clínica médica o vaya al médico. No espere que esté tan enfermo que ya cuando vaya ya es muy tarde. El doctor Barón, que el alcalde Turner conoce muy bien, es un gran colega, un gran médico aquí en Houston. Yo he hablado, platicado con él muchas veces. Muchos hispanos están esperando hasta el último minuto ir al doctor y es muy tarde. Por favor, hagan caso a las autoridades de la salud pública y más importante, si está enfermo, vaya al doctor. Okay, that's my report, Mayor. Thank you.
And also from the Health Department, I think we have Mr. Valeriano, who can talk about the community outreach and things that have been done in from the Health Department, especially as it relates to the Hispanic Latinx community.
La amenaza del COVID-19 que enfrenta Houston y particularmente la comunidad hispana es más grande que nunca. Los hispanos es el grupo étnico más afectado a este momento. El Departamento de Salud de Houston está reportando que el 46% de las muertes que estamos viendo son en la comunidad hispana. Por ejemplo, hoy, como anunció el alcalde Turner, todas las muertes fueron en personas hispanas. Es muy importante recalcar que las campañas que está haciendo el Departamento de Salud, así como la ciudad de Houston, son de gran importancia ahora. Por ejemplo, estamos pasando el material educativo, las visitas casa por casa en diferentes vecindarios más afectados. También estamos haciendo los anuncios y pancartas y también presentaciones a negocio. Al momento tenemos pues una transmisión en la comunidad que no está controlada. Por eso es importante recalcar que hay que ponerse la máscara, también distanciamiento social, lavarse las manos muy a menudo y también si la persona siente cualquier síntoma o se da cuenta que estuvo con una persona que tiene el virus, que salió positiva, es importante hacerse la prueba. Al momento hay hubo mucha demanda en semanas pasadas, pero al momento hay bastante lugar para que la persona que no se ha decidido a hacerse la prueba lo haga ahora.
Thank you so very much. Let me also say that, as Dr. Persse indicated, getting tested is important, and we have seen in the last week so the numbers going down in terms of the number of people getting tested. Again, let me encourage everyone, please go and get tested. That's very important in protecting yourself and your family members. The Houston Health Department and its agency have 18 testing sites across the city for the week of August the 3rd. I also want to mention that on August the 8th, a testing site will be open next to Minute Maid Park downtown. It will be state supported and operated by Davico Inc., one of the Astro owners, Jim Crane's subsidiaries. So the city of Houston will provide Houston Police for traffic management, and Houston Health will promote the site. So that testing site right next to Minute Maid will be open on August the 8th. You can always get information about all of the City of Houston testing sites and their locations at houstonemergency.org, houstonemergency.org. Having said that, let me just say, and we'll take questions, there are way too many street parties that are taking place in our city. Too many street parties, they need to stop. There are still too many house parties, and quite frankly, the community spread is spreading by way of these house parties. Backyard parties, barbecues, street parties, Zydeco's on the corner, way too many of those, so please bear in mind. And no mass taking place. And I'm getting calls on Saturdays, Fridays and Saturdays, 10, 11 o'clock at night, so bear in mind. Put your mask on. You run the risk now of getting a citation and a $250 ticket, and I think you can best spend those dollars someplace else rather than contributing to coffers because you don't have a mask on and you are subject to getting a citation for $250. Please don't blame the police. It is a requirement, and we're holding people to it.